Does your loved one have venous stasis and have wounds from venous stasis? I'm going to talk about venous stasis ulcers today. I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. My specialty is wound care. I help patients who are homebound or bedbound and can't get to a doctor's office, hospital, or institution. So a lot of patients I see have something called venous stasis. What this means is that the venous return from usually the legs is impaired, meaning that the blood flow can't return to the heart, which means you get swelling, and all those metabolites that are processed by the soft tissue in the capillaries or small vessels create these little toxins that get stuck and lead to ulcers and wounds. So one of the mistakes I see that's made with these type of ulcers and wounds is people just put creams or what some of my religious patients call schmears on the wounds and think it's going to heal. If you don't address the underlying issue, which is the venous return, you're not going to heal these wounds. So how do you heal these wounds? Well, number one, in terms of wounds, you have to evaluate what it is. With venous stasis ulcers, you have to make sure there's not an arterial component. We talked about the venous flow, which is the return back to heart. We have to make sure the flow to the foot is not impaired. Usually you do that by doing ultrasounds or checking something called ABIs, which I'll go into more detail in another episode. If there's arterial disease, then you have to do less compression, meaning you can wrap the legs to squeeze the legs so that they have better blood flow, but you can't do super compression because that will possibly impede the blood flow down to the toes and the feet. So in terms of wound care, the most important thing is, like any wound, is cleaning it out. And you want to put a dressing that won't stick, but also allows for the fluid to be absorbed. A lot of the venous stasis ulcers I see have enormous exudate, we call drainage. So does it make any sense to put creams or gels on a wound that's draining? What happens? All that fluid that's coming out of the wound is just going to blow or wipe that all the gel and ointment out. So you want to dry these wounds. Now you don't want to put something that's going to stick because that can be painful in the next dressing change. So I generally use something called Adaptic, which is a contact layer, and you put a lot of foam or padding, like abdominal pads, or an absorbative dressing, such as an abdominal pad or a hydroconductive dressing like Drawtech, and then wrap it with Curlex, which is a wrapped up gauze, and then usually I do either an ACE bandage or something called Coban. Coban is kind of almost like a plastic material that really squeezes the leg. And this has to be done generally every other day or every day, depending on the amount of the drainage. Some of my patients who have chronic venous stasis, they get what's called lymphedema or venous pumps, which are basically these long sleeves that go on, almost like a big sweater, but it's made of a different material, and it squeezes the leg to get that blood flow return. So all those toxins and metabolites that are processed can go back into the larger veins, which can go to the heart, and then you can obviously urinate these metabolites out. Now, these wounds can be very difficult to manage, and there's other strategies we can talk about in future videos, but the most important thing is pressure. You have to address that edema and that swelling and squeezing that blood flow back to the heart. If you have any questions or comments, please feel free to put them below, and make sure you subscribe to the channel when you get a chance. Thank you so much, and I look forward to our next episode.